My topic today is very common. I'm talking about eczema. Now, many people come to my clinic asking, why is my child having this skin? It's often dry, itchy, sometimes scaly, weeping. Sometimes we see the edge of that area and sometimes we don't. Often in young children, it happens in the lateral areas, which means on the outside. So often the cheeks, the outer arms and outer legs. As you get older, it tends to go into the folds. So the arm folds, the leg folds, and behind the knees. And when you get as an adult, it tends to happen more in the hand, on the feet, and sometimes in the face and other places as well. It's a very common problem. We see it in about, let's say, 30% of children, and maybe about 5 to 8% of adults. We know that it happens in people who have a genetic predisposition. So basically, they are born with either one of their parents having some form of allergy. The parents could have skin allergy, or they could have a nose allergy, or even an asthma or lung allergy. It doesn't have to be eczema, but you would have the genes predisposing you to have eczema as well. Eczema gets infected sometimes with viruses and bacteria and gets very, very painful, very, very itchy, and very disfiguring. If it becomes chronic, the skin becomes lichenified, which means very thick and very dry. Sometimes eczema is caused by the environment, by food or other things in the environment. And sometimes eczema is caused just by genes. So the difference is what we call allergic eczema or non-allergic eczema or atopic eczema, which means genetic basically. The key is this, and this is a very important message. If the child is under 6 months of age and has, let's say, moderate to severe eczema, which means not so little eczema, then they have to rule out food allergy, especially milk allergy, because about 50% or 40% of those children would have food allergy. As we get older, the chance of food affecting our eczema becomes less and the environment becomes more important. Things that make eczema worse, sometimes, as we said, could be food, but other times it could be changes in the environment. Use of detergents and soaps, even the brands that give you perfumes in the clothes, using exposure to animals sometimes would give you that as well. Pollution would give you eczema and worse eczema. Change in temperature, so too much heat or too much dryness would make your eczema worse as well. If you overuse soap and over clean yourself, you'll result in eczema as well. The bath is a very interesting one, because if you take a very long bath, you make your eczema worse. If you take a short bath, you're okay. When you do a longer period of time with the bath, you lose the natural oil that protects the skin, and that's what makes your eczema worse as well. Now, what I do for my patients, often I test them for food allergies and environmental allergies and give them instructions of how to reduce the chance of eczema. Before I talk about how to deal with eczema, I want to talk about milk allergy and food allergy. I talked previously about how to do the test for allergy, but I'd like to explain to people who have children who suffer from cow milk protein allergy the following. You need to go on a special formula if you have cow milk protein allergy. The formula of different brands is made so that it doesn't give you the allergy, but gives you the benefit and nutrition required for the child to grow. This formula often tastes very bad. It doesn't taste good and doesn't smell good either. So the best time to give this formula is at younger age, when the child does not appreciate the taste of the formula. So around, let's say, 2 months or thereabouts, or 3 months. Once you get about 6 months or more, it becomes very difficult to give the child that formula. It becomes more complex to try to find a solution. We often do, although it takes a lot of time. Talking about the management of eczema, the most important thing to think about, other than avoiding the triggers of eczema, is that to moisturize extensively. Moisturization cannot be re-emphasized. You need to keep moisturization in the skin all the time. So twice a day at least, if not more. In doing moisturization, do not use the liquid lotions too often. The lotions are very light and they evaporate too fast. So to apply a lotion and give the moisturization, you need to use it, like say 5, 6, 7 times a day. Using a thicker cream twice a day will be as effective, if not, and less laborsome. Many parents suffer from giving the creams for the children because children don't like creams. and they want to run away and play, they don't want to give the creams on the skins. So it's best to have a short treatment twice a day with the same effect than having multiple treatments where you cannot catch the child and give them the creams. The other thing to treat with is topical steroids and topical anti-inflammatories, which are non-steroids. Now, the steroids we all know, and we talked about the potential use of the steroids and possible side effects. If you use steroids on the skin a lot, you can suffer from thinning of the skin, the blood vessels may show more, you get more bruising on the skin as well. And if you use a large surface area of the body, it can result as well in a lot of absorption into the blood, and it can affect you in a systemic way, so it affects your sugar as well. So we don't like, as doctors, to use a lot of steroids on the skin unless you use it for the emergency case, when you need to make sure that the skin is healing better. Sometimes children suffer from burning, and they say it burns to apply the cream. That often happens because the skin is wounded. In this case, you should apply a thicker cream or a thicker steroid that doesn't have too many additives in order to avoid the irritation and burning in the skin. I like to use steroids because I need them sometimes for a few days, maybe a week or 10 days, more or less. But it's best to always take care of the skin by avoiding the triggers of the eczema and using other treatments that are not steroids. For example, there are treatments that are called picrolimus and ticrolimus, which are anti-inflammatories and they are not steroids. They can be used what we call in a proactive way. Proactive means preventing eczema to come back. It's the concept from using a large amount of water to calm down the fire, or using a small amount of water to prevent the fire from coming back. So you can use a steroid at the beginning to calm down the fire of the eczema and make things better, but you cannot use it for a long time. Then you have to switch another medication that would control your inflammation and control the eczema without applying too much steroids. Even by applying twice a week, that would be a good effect. Currently, we are lucky because we have a new medication coming out and other new medications coming out which could treat eczema that are not steroids as well. One of them is called Dupilumab. Dupilumab is an injection. It's called a biological medication. It's called anti-IL-4, which means it suppresses IL-4. It's one of the inflammatory mediators that gives you eczema symptoms into your skin. It's an injection that gets given every 3 weeks almost, although it can be 2 or 4 weeks. It has excellent results as well in patients suffering from severe eczema. So it's preserved normally and kept for adults who have severe eczema. It's unfortunately very expensive, but it's very effective as well. At this time, I'd like to conclude the talk about eczema specifically, and I'll talk to you at another time.